Hello.
Awesome. Thanks, Sai. Super duper.
Problem.
And Doug, Doreen, Linda. Oh, we got two Lindas tonight. Uh-oh. That'll confuse my simple mind. I guess we'll have to say Linda 1 and Linda 2 here. There we go. Awesome. Well, beautiful spring day today. Has anybody gone for a walk outside today? Put your hand up if you've gone for a walk outside today. There we go. Good job. Got some fresh air. Yeah, I walked the dogs. You almost need rubber boots in this weather now, hey? It's crazy. Awesome. So we're at 7 o'clock. How many do we have in now, Sai? Oh, here comes Judy. We can admit Judy. Do you want to admit Judy? There we go.
Yep, 17.
17. Oh, we're getting close, getting close. We'll give it another minute. Hi, Judy. I don't see you.
No, I don't want to be seen.
Oh, okay. Are you in your pajamas already?
I got my teeth out and everything. No, just kidding.
Yeah. Yeah,
oh,
I know.
What the heck? There you go.
Oh, there you go. You look just fine. You look beautiful.
Oh, yeah, thanks. I'll send you your money tomorrow.
Oh, there you go. Thank you. Thank you. Yeah. A little COVID tip there. Yeah. Thank you.
Yeah, right.
Appreciate that. Yeah. Awesome. Well, I'm really excited tonight. We're going to talk about low back pain, which is probably one of the top sort of injuries we treat on a daily basis in the clinic. And there's lots of stuff that we could do individually at home just to manage our back pain. And we're going to talk about lots of ideas on things that you guys can do. And then, if you apply these things, for some of you, it'll actually take your pain away. But for some of you, you'll try it, it may change it a little bit, but it might only change it 10%. But even a 10% reduction in low back pain can be huge in your quality of life. But if it is only 10%, we would encourage you to follow through with Shandu and book a discovery visit and just talk a little bit more about your back pain and how it came about and what your history of that was. And he can sort of just quickly analyze kind of where you're at with your journey on your back pain. 80% of the population will have lower back pain at one point or another. So it's a very common pain for all of us. It's just the way we're built. And it's also the way we kind of wear out. As our spine wears out, our spine doesn't like going backwards because of the arthritis. Our spine likes to go forwards. And my mom, just a little story here, she's got dementia just recently, and she's also got a very stenotic spine. So she finds she gets relief when she sits. And she also gets relief when I take her grocery shopping and she leans on the cart. So she'll lean on the cart and she'll just boogie all the way around the grocery store with no pain in her back because she's in that flexed kind of position that opens up the little holes where the nerves come out in her back, and she's quite happy. But if you get her to stand up straight, she just goes, "Oh, there's that pain in my cheek again, Blair." And she likes the needling, but it gives her some pain relief. But again, it doesn't completely fix her, but it definitely gives her some relief for a few days. So every time I drive up to see her, I always needle her and mobilize her a little bit. And the other thing that really works for her is heat and just pulling your knees to her chest. And that's something that Chandu will talk to you guys about tonight as well. So there's some simple things you can do. All right, so how many in the group now, Sai?
19.
Okay, perfect. That's usually 50% of what we had registered, so that's good. So I'd like to get started, and the first thing I'd like to do is I'm going to introduce Sai, who's batting tonight, hitting for Bill, who's away tonight, and I'll get on, and she's going to help us out. So if anything IT goes wrong, we'll ask Sai to help us out. And then my name is Blair Shaktu, as a few of you know. I've started with Nose Creek 20 years ago in Calgary, and just feel blessed to be in the community that we're in, serving the people we serve. And tonight, I'm really excited to introduce you to Shandu. So Shandu joined the clinic back in November, and he has been a physiotherapist now for 17 years. So like, he's not a new grad. This guy's been around for a while. He's got some experience, which is great. And so he's worked in India, the United Kingdom, and England with all their British folks over there, and in Canada. And he's come to Canada about 5 years ago. So I think he's like a true Canadian now because he's been here for 5 years. So we like to think of him that way. And he's very passionate, just like I am, about keeping people moving pain-free as they can and increasing their quality of their life. And another modality that Chandu does that certainly most of us don't in the clinic is acupuncture. And acupuncture can be another great modality for modulating nerve pain, which is primarily what we're talking about tonight with low back pain, is going to be a lot of nerve type pain. So without further ado, I will mute my little voice now and I'll let Chandu take over. So there you go, Chandu.
Thanks, Blair. Thanks for the warm introduction. So hi, everyone. Nice to meet you all. And here I'm going to share my screen with the power slides to start with. So let me start sharing this screen. Can everyone see the slides now?
Mm-hmm.
Yes, hi. Yeah. Right. So so my name is Chandra. I'm a physio. As Blair said, I work at Nose Creek. Today's topic is low back pain, and we are going to discuss briefly why we get low back pain and simple techniques to minimize the back pains. That's the main topic today. And today's agenda is we are going to discuss about simple anatomy of the back and what are the common conditions we exposed to in general, and top 10 secrets to reduce that low back pain. And we are going to talk about 5 modifiable risk factors where we can follow that and minimize the pain and protect our back. And once we're done with that, we're going to have a little chart about which one to pick. Do I have to pick heat or ice? We're going to have a little chart about that. And I'm going to talk about the red flags. It's very important. If we find any of these red flags in our body, it's important to see the doctor right away. Once we are done, we will talk about the myths about the management of the low back pain, and we're going to show you a few exercises that helps to control our back pain and keep us mobile. And then we will address few frequently asked questions, and then we will show you a few testimonials, and then we enter into the draw. Maybe that's we'll talk about that. And then in the end, we are going to address the questions, and we'll answer the questions what we have been going through. Okay, that's the general agenda. We'll try to keep it on time. Let's see. So let's talk about the anatomy of the spine. As we are seeing in the picture here, so the low back is we call it the lumbar spine, which is made up of 5 vertebrae. So here is vertebra L1, L2 to L5, where all vertebra sits on a sacrum bone where the mouse is running, right? So, and this sacrum is connected to 2 pelvic bones on either side. This is the general simple bony structures of the spine. And in between every vertebra, there is a structure called vertebral disc, right? So that's a kind of a shock absorber and helps to control the mobility as well. The main function of our spine is to how we are moving, and that's the main how we are controlling, how we are shifting the weight. That's the main function of this vertebra. Okay, lumbar spine. And common back pain, what we generally expose is inflammatory or disc issues. That's very common, and I'm going to talk about how we need to manage that one. And the next very common is stenosis or arthritic changes, which generally we see in people who are after 55 age and above. Generally we exposed to lots of wear and tear on the spine, and what we need to do. So we are going to have a small discussion about that one. And the next one is a sacroiliac joint pain. So as I showed here, that's the sacrum, that's the pelvis, and the joint in between, and any wrong alignment around this joint, and that can give us a give us a pain, localized pain, right? So let's talk about individual one. So inflammatory low back pain. So I'll talk about the structure. So here is the disc, and this is another disc in between the vertebra. Sorry, it's a vertebral body, and this is another vertebral body. In between the disc is there. If we see the general structure of the disc, on the outer layer, blue color, is a kind of a strong ligaments, 12 layers of annulus fibrosus ligaments that is covering the nucleus pulposus. It's like fluid side structures. It acts as a shock absorber. So in patients who have this disc problem, right? So when we try to lift any kind of heavy weights, like bending too much, what happens is it puts lots of pressure on the disc, and if pressure is too much, sometimes it will prolapse and it won't return back. So this is called the disc herniations. In the severe cases, what happens is it will put, if the disc herniation touches any nerve root coming out from the spinal cord here, this nose doesn't like to be touched, and we will get lots of severe pain going down to the leg. Depends on which disc we disturbed. Okay, and this is a common, very common inflammatory low back pain we generally see. And next one is lumbar stenosis. Stenosis is a narrowing. It means a narrowing. So what happens generally we see in age above 50 or 60, and at that age we expose lots of wear and tear. If we see here in the picture showing here, the disc spaces are disc healthy and the spaces are well maintained. Whereas here, what happens at the age around that age, the disc gets dry and it cannot take too much of a load, and it will pass to the body of the bone, and it'll start narrowing again further. So it is putting the lots of pressure on this area, where it's becoming the gap is becoming very thin. And another thing is, if we see this vertebral body is sitting on another vertebral body, this is the surface where it lands on. We call it as a facet, and this is a facet joint. And if we repeated wear and tear, that can build up the arthritic changes. In chronic cases, it will build up a kind of a bony outgrowth. We call it as a osteophytes, and that can further narrow. And if anything pinching around that area, it will give lots of pain. Especially this happens when we try to lean back. That's more painful and sharp pain. And if it is narrowed too much, again it's putting the pressure on the nerves, and depends on where the pressure is. Generally we see in the lower L4 L5 zone area, that will give some radiating pain down to the legs as well. So this is the general information about stenosis. And next one is sacroiliac joint. So as I said, this is the pelvic bone I nominate, and this is the sacrum, and this is the joint where it sits on it. So it is covered by so many ligaments. This is the front side view, and there are so many ligaments at the back side, even more stronger. What happens, generally we see this condition in after pregnancy, where there are some hormonal changes where happens, and that makes these ligaments more softer, and it is not holding this joint. So wrong pressures can rotate the pelvis to, we call it as an anti-rotation, that and a wrong alignment of any joint will give the lots of pain, discomfort. Generally, patient who have the sacroiliac joint, they say, oh, I'm having the pain at the lower back. They'll point out around the joint, and it is mostly localized pain. Okay, that's sacroiliac joints. These are the very common conditions we expose to. So how we do manage? So how we do reduce the risk? So there are top 10 secrets where we can, where you can find it on our website, or you can, if you want this copy, we can please email us. We can send you copies to your email as well. So let's go for that one. So anyone who have back pain, we encourage to be active and keep walking, please. So if once you start walking in the morning, afternoon, and evening, so that helps to move the joints freely and keep the muscles more active, so that we are avoiding the stiffening of the muscles, and it will increase the flow of the blood. So it will be less stressful to the joints when you are keeping your joint muscles and joints, ligaments, everything more flexible. Okay, so that's why we always encourage to walk as much as possible. That's very, very important. Okay, so next one is avoid prolonged sitting, right? So for example, if you spend a lot of time spending in a chair or sofa, so we tend to stiffen our joints. What happens is our posture is another thing we need to address. So if you sit in a long time, we tend to slouch a lot, and if you maintain that for longer time, you are putting lots of pressure here. So Again, this posture, I would like to talk how much pressure you are putting to the discs, at the back. When you lie down, the pressure will be very, very less. Okay, so when you lie on your good side, for example, if you have a pain on the right side, if you lie on your good side, the pressure will be a little bit less when you compare to the lying on your left, right side, painful sides. That's why we encourage to lie on yours when you have to lie on your side. Always try to lie on your good side rather than on your bad side. Okay, and this pressure is increased when I'm standing. If I'm standing for longer time, definitely there is a lots of whole body weight falls on the disc and you are putting lots of pressure. So when I'm doing in standing and bending, this is the movement where it's putting more the three-fourths more pressure on the discs. Okay, if I have to bend and lift a lot heavy weights, definitely we are adding 3 to 4 folds of the pressure on the disc, and this is the very commonest reason why we hear, oh, I try to lift and I twist, I felt the pain in my back. This is a very commonest reason we hear in our clinic, people who are coming with that inflammatory disc bulge reasons. And another thing is when you sit down, right? So again, that is putting even more pressure than when we are standing up, right? So it's almost even five to 6 folds more pressure when you sit for longer time and wrong posture. And if you do the same activities, like you're trying to do some activities sitting and lifting, that's another way you are adding even 9 folds of pressure onto your on your back. That can create lots of troubles to the back. So this is very, very important to maintain a good posture and keep changing the posture as well. So if instead of sitting for longer hours and instead of sitting in a longer hours in a wrong chair or long sofa, keep moving, keep standing. And yeah, so if you're working in a chair, if you have to work 8 hours a day, we encourage to use a sit to stand desk. That way you will keep moving to change the postures, it change the pressures. And if you notice, if I'm standing, I don't stand still, I keep moving. That way you're burning a little bit more energy, you're keeping your body warm, and you're keeping using of your muscles. That way you can avoid stiffening or easing the stress on the jaw, on the back. Okay, next one, sleeping. Okay, sleeping is an important aspect. As how we are sleeping is another key. Mechanics of the sleep is another key. So if you have to sleep, people who have the stenosis, right? So arthritic changes in the back, we always discourage to lie on their stomach. What happens is, if when you lie on stomach, if you're keeping your body, sometimes we keep an body in kind of extension position where you are putting the pressure on the facet joints a lot, and you have to wake up in the middle of the night, you have a pain, and because you are putting lots of pressure and giving that irritation to the joints, and that's another thing. So again, another thing is, as I said before, if you have to lie on your side, you lie on your good side rather than on a bad side. Best thing is lie on your back with extra supports like a bolsters, as you have seen here. I'll show if you can see. So this is a bolster here. So I can see in our clinics. So that helps us to okay, yeah. So bolster helps us to keep the alignment of the bone and soothe the muscles. So the stress will be very, very less when you use those bolsters. If you don't have the bolsters, try to add a couple of pillows under the knees when you lie down on your back. And these pillows, when you're lying on your side, if you have to, so we encourage to keep the pillows in between the knees. That way you are not twisting your pelvis too much. Okay. Or here are the pictures. We can see here the person is lying, keeping the extra pillows. They're keeping this way. You are keeping less stress, and the muscles also kind of a very gentle stretch, which is a soothing effect it can give. Same with the bolsters too. Same on the sideways. Encourage to lie on your good side, keeping the pillows in between your knees like this. Okay, so if in case if we have to lie on your tummy, generally we discourage this one. Keep extra pillows under the tummy. That way you are not extending your back too much. So this is the proper positions where you need to use the pillows. Okay, and that keeps the stress less on the back. Okay. Next one, yeah, leg crossing. So generally we see whenever we sit in a sofa or whenever we sit in a meeting like that, right? So generally we see in a female more than male. We tend to cross our legs. So what happens here is when we cross our leg, we are trying to tilt the pelvis as well. We are putting the pressure, too much pressure on that joints, SI joints, and the back too. And if you maintain that for longer hours, it is cutting the circulation too. It is putting the pressure on the veins. It is not good for the circulation too. So we always avoid crossing the legs if at all, and try not to go for too long time too as well. Keep changing the positions. Okay. Next one is ice. Okay, so when ice is a good tool to calm down that inflammatory changes. So for example, if okay, so I have back pain, but I did something wrong. I felt really sharp pain, which is flared up to kind of a 7, 8, 9 out of 10, and I don't know what to do. So ice is the best friend at that time, and that helps to calm down the irritation and promote the healing part too. So next one comes heat. So when do we use heat is we can use heat if you feel so much tightness or dull ache. If the pain is kind of like more than a week or 10 days, the heat is the best option. That helps to relax the muscles and improve the circulation and promotes the healing too. So we're going to have a little more discussion about these two as we go. Okay. Next one is walking. As I said before, always be active and try to if you can make yourself to walk 3 to 4 times or 5 times 6 times, morning, afternoon, evening. Be active, keep walking. That way we are keeping our body more active, and the brain is also recognizing that, oh, you are mobile more. That way that is not sending a wrong impulse to become stiff as well. So again, it moves the joints, it helps to maintain the length of the muscles. That way we don't feel too much tight in our body, hips, knees as well. So that will help a lot with the walking. Okay. Next one, you're following all these but still you are having trouble, the pain is not going away. That is the time to seek help. So we as a physiotherapist, we can do a comprehensive assessment. We can find out where the problem is the problem is a common mechanical low back pain because of the tightness and the weakness of the muscles, or is there any nerve irritation happening, or is there any really disc issues? Sometimes depends on the subjective history, we can identify sometimes red flags. I'm going to discuss as we go, and we can guide you as well. And this is the time you need to seek help, right? So this is the main top 10 secrets which we would like you to you follow. Okay. Next one, mechanics of the body, right? So lifting, twisting, cleaning, everything. These are the common activities we exposed to. So here these guys are doing, this guy is lifting the weights. Whatever the activities we are doing, we encourage to keep the back always straight rather than bending or twisting. Okay. So here I'm going to give you a few simple instructions. So imagine you need to lift any weights from the floor. Okay. Sorry. So instead of generally what we do, we tend to go bend down and lift it up, right? So that's where you are adding 6 to 7 folds of pressure on the disc. That's the commonest reason. Oh, I try to lift something, I felt the pain immediately or after some time after next day. So this is the commonest reason what we hear. So here what the simple technique is, just imagine, try not to go for lift for too much weight beyond your capability. First thing, if you have to lift the small weights, even keep your feet a little bit apart and bend your knees. Use your leg muscles more than your back muscles. Always try to keep your back muscles, back straight. That way you are not, you are reducing the stress on the discs, okay? And then another technique is where as you're lifting, always keep the weight close to your body rather than reaching far away. So again, this is another one which we tend to do wrong. And again, when you try not to twist too much, so instead use your footwork more rather than turn your whole body rather than you turning your back. Okay, so these are the simple techniques with the lifting that will protect our back from the damaging. Okay, the bottom guy is doing the shoveling now. So again, it applies to not only shoveling, any activities that we are doing repeatedly, right? So for example, if we are cleaning the house, we are using the vacuum and we are mopping, right? So we encourage to use a long handled tools rather than the short handles one. That's one thing. And if we have to so clear the snow, try not to clear too much of big chunks of snow, and try not to throw. That is another reason we hear. So I did some snow clearing or raking. I felt pain there. I mean, there's another reason we generally hear. So what we do, take small amounts and big long handles, and try to use your body rather than twisting your back, and just twist the tool rather than throwing it too far. Okay, that way we are not adding any pressure to the back. That is very, very, very important, and this is the commonest reason we hear in the clinic as well. Okay, so the simple mechanics, if we maintain, that will reduce the stress on our back and will minimize the damage too. Next, let's go for the risk factors where we can modify and reduce the stress on our back. Okay, so first one is mobility of the spine. Again, we your part is to be active. That's in your hand. So what we can do in our clinic, we will do some mobilizations. I mean, Blair can do manipulations and those kind of activity. We can show you activities that can keep the spine a little bit mobile, more mobile, and it will stop stiffening of the joint. So that's we encourage always to be active as much as you can. Try to do any activities as much as possible. Make sure you're not doing too much or not too less. That and keep yourself mobile as much as possible, please, always. Okay. Next one is the core strength. So this is another very, very common key muscle. We always tend to encourage, always tend to give to every patient who are with the back pain. Why? Because it is bracing our back. So most all the muscles except the one, it will starts at the back. Few connects to the pelvis, to the ribs, and few connects directly to the spine itself. So if their muscles are weak, it is putting lots of pressure on the back itself, and you are using the back muscles more, and you are changing the mechanics of the back, and you are adding so much of load by keeping your ab muscles very, very weak. So it is important, very, very important to strengthen them, to brace your abs and the back as well. So it is one of the most important key muscles where you need to keep them really stronger. Okay. And people who have really weak abs, they always get the back issues really faster. Okay. Another muscle is hip muscles. Oh yeah. So again, another one is hip flexibility, right? So okay, for example, I'm just showing my back here. So here's my back. Next joint, big joint, is the hip. So if I have to do something, if I have to bend forward, it's better to use my hips and bend your hips more rather than the back. But if in case my hips are really tight, if it is I'm not moving my hips enough, what is the joint moves next is the back. So my hip is not moving, then right away I'm going to use my back. Okay, so that adding, as I talked in the before, I'm adding 7 to 8 folds of the pressure by bending myself and not bending my hips. And you are putting lots of pressure on the disc and the back too. Okay, so and you're going to use your back muscles if your hip muscles are weak. That's another risk factor, and we need to keep these hip exercises really in flexibility and strengthening exercise as well. That's very, very important. Next one is weight, right? So every 1 kilo of weight gain we are putting 4 folds of pressure to our back. Okay, if you lose 1 kilo weight, you're reducing the stress to your back 4 folds. That's another thing. That's why we encourage you to consider the weight control programs, and it's very, very important. And just follow what are the main instructions you need to do, and sometimes diet control or activities, keeping activities and exercises. These are all the main. You need to burn your calories. These are the main aspects where you can control the weights, and we will encourage you to consider that really strongly. The more weight you gain and more pressure you are adding to the spine. Okay. Yes. Next one is smoking, right? So smoking is one of the reason it'll damage not only back, it's damage the whole body, right? So it is disturbing your respiratory system. That's commonly we see smoking. It's not allowing to take enough oxygen to the body. It's damaging the circulation. It's bringing the clots, and it's damaging the bone. It's thinning the ligaments. It's so many things it does if we have the habit of smoking for years and years and too much, right? So generally we see this one very commonly. I would like to give this example. So person who is not non-smoker, person versus a smoker, have the similar kind of injury. Person who is non-smoker is recover faster, and he will maintain that recovery really for longer time, rather than compared to this person who is smoking chronically, because again, as I said, his oxygen transport is weak, and energy is weak, and blood is damaged, bones are damaged, density is damaged, structures of the ligaments which is holding the bones are damaged. So many things which is happening with the smoking. So that's why we strongly encourage to stop the smoking. If we find difficulty, you find the programs where it helps to minimize or stop the smoking, right? So this is the very strongest suggestion we would like to add. Okay, next one, let's talk about yeah, so I have back pain. Which one do I have to pick? Do I have to pick ice or heat? So there are simple ideas here we presented. Okay, so you got the back pain suddenly. By doing something, I did something. I feel sharp pain, and my pain is more than 7, 8, 9 out of 10, and I feel though we don't see swelling too much, but we can feel it. Then there's inflammatory changes to control it. Ice pack is the best option, and the duration of the time is a kind of a new injury, and ice is the best one. Okay, but no, the pain is there. It is a dull ache, and it's I feel so much tight, and it's been there for weeks and weeks. And then we always encourage to use the heat pack more, and that helps to increase the circulation and really, relax the muscles and promote the healing. So this is the simple options. If you feel sudden increased pain, and the pain is weighs more than 6 or 7 or 8, 9, ice is the best option. And if you feel dull ache, it's been there for a longer time and it's been happening, heat is the best option to relax the muscles. Okay, and the same chronic back pain is more than, if you have back pain more than 12 weeks, we say it as a chronic back pain. And if you have a new episodes or new incidents, again, you need to consider the same formula. Do I have to use ice or heat? Okay, that's where we pick. Okay, so how soon do I start the gentle exercises, right? So depends on the extent of the damage. Generally, this is the thing we notice. So We encourage to start start being active as soon as possible, as the body allows. So generally we encourage to walk 6 times per day, right? So as I showed here, at least 10 minutes walking. So in the morning, afternoon, evening, whenever you find the time. So morning 2 times, noons, afternoon 2 times, evening 2 times. Whenever you find the time, just go for just at least keep moving inside the house at least, okay? And if it is an inflammatory disc issue, generally to calm down the inflammation, we need at least 2 weeks time minimum, provided you are protecting your back really well. If you do something again wrong, again, we need to, that you are irritated the tissue, again, that takes a little extra time too. And most of the general back pains, mechanical back pains, it takes 6 to 8 weeks time. That's a general timeline we see. If it is a very simple one, it can go up to 4 to 8 weeks. No, it is a really bad damage, bad injury. It can take up to 16 weeks to see a good result of the back from the rehab. So it is very, very again, it's based on what we are doing, how well we are protecting, how well maintaining these risk factors, how well we are maintaining the mechanics, all considering everything, this timelines follows, okay? So red flags are the something where once you notice, you need to see the doctors immediately. So what happens especially with the low back, right? So okay, I'm started losing my control of walking, or I'm losing the coordination, so sudden changes, I don't know what is happening. That's one reason. And I'm feeling some I'm losing the control with my bowel and bladder, and I'm not feeling the sensation around in between my thighs and the groin area. So that's what we call as saddle anesthesia. And the pain is more at night, and sweating, and constant pain, and it's not changing with whatever I'm doing. Oh, I'm taking medication, it's not changing. I'm trying to do some activities, it's not changing. And I did some stretches, not changing. So that is the time we need to see, oh, what's happening, right? So do I have anything which I need to be checked? If you feel any, for example, if you have any infections, you will feel fever, night pains, and night sweats, some chills. You will get all these signs, right? So along with that. So this is a time where you need to see the doctor, okay? Or another thing is significant trauma, right? So if you had a fall, or if you had an injury, something had happened, you slipped on ice, oh, I don't feel, it's not easing the pain after even 1 day, 2 days, no change is happening, even it's getting worse day by day, every day it's getting worse. That's the time you need to see the doctor, okay? These are some red flags we would like you to know and see the doctor right away, okay? And common red flags we see here is the cauda equina syndrome, where the spinal cords ends at the top of the lumbar vertebra, and the nerves will pass and distributes down. If any damage happens there, thus we call it as a cauda equina. So where you feel numbness happening and no feel of, as I discussed before, the no feel in the middle of the thighs, and you are not feeling the groin area when you're wiping the tissue. Or you are gradually losing the control with the urine, bowel, bladders, and these are the common. If you notice any of these, this is a kind of a red flag where you need to see the doctor immediately. Okay, and so you need to seek the medical information. Right, so this is the commonest red flags we notice. Now, let's go back to the management and myths, right? So let's talk about the myths of the low back pain, right? Oh, now bed rest is best. Okay, so, right, I have back pain. In olden days, we used to say, oh, if you have pain, take rest. That's is an old thing we used to say. But now what we are saying is try to be active as much as possible, as I have been saying, right? So you keep yourself very, very active. Try not to stay in one position for longer time. For example, if you are stable, if you take the bed rest for a week or 2 weeks, you are making yourself more stiffer and damaging. It's not helping with the healing problem too, and it can create a new problems too. So always try to keep changing the positions, try to be active as much as you can, as allows, okay? So bed rest is for a longer time is not a good idea so far. Okay. Next myth is, oh, I have a back pain. It's been there for a long time. Oh, I need to get I need to go to the doctor. I need to have an MRI, X-ray. So how true is it? So again, we don't mean most of the back pains. As I said before, we can do a comprehensive assessment. We can identify where the problem is coming from. By checking the different, based on your history, what's happening, by doing some physical tests, physical activities, we can identify where the pain is coming from, what kind of pain it is, and we can check the tightness of the muscles or weakness of the muscles. So how is it contributing to the back, right? So we can, by doing this one, we can mostly we can identify where the problem coming from. So you don't need the MRI. So when do we need MRI? So if you find out any red flags, or if you tried everything, or you tried a physio, you tried taking a strong medication, is not going away, then that's the doctors will think, oh, okay, what's happening in the back? So let's see how extent is the back is. That's the time they recommend you to go for radiographs, right? So not every back pain or simple back pain need X-rays or MRIs, or common back issues doesn't need MRI at all. Okay. Next one is, oh, I have more back pain. It's getting worse. I'm thinking I damaged my back really bad. Okay. This is how we generally tend to think. But what happens is, again, the mechanics, what we are using, how well we are managing with our movements, how well we are, how active we are, and how tight our back is there anything touching the nerves, is all considers here. So right, so sometimes a simple correction of the posture can reduce the pain right away. So sometimes doing this exercise quite regularly, that can clear the problem right away. It's not it's not like the more pain you have, the more damage we don't need to think that way. We need to identify where the pain is coming from, what is the reason for the pain. That tells where the problem is, and how that gives an idea and guideline. What are the activities we need to do, what are the things we need to avoid. That's the main thing we need to look for. Okay. Not like I have more pain and I need to take more medication, or I'll go to doctor, I'll take more medication. I have more pain, something happened to my back, give me so strong medication, it will reduce. Medication just try to minimize the pain, not to treat the root cause, right? So, but that's what we need to look for, main where the problem coming from. Okay. Another one is, oh, I have back pain, I need to go for surgery. Again, this is also a wrong myth. Most of the back issues doesn't need back surgeries, and we keep it as a last option, right? So again, maintaining good mechanics, maintaining the good level of exercises and good postures, good mechanics, and all try to minimize. Most of the cases will minimize with exercises and maintaining the good body mechanics and maintaining a good healthy activities. This you can keep our back really good functional positions. Even though back is damaged, it can recover really good even with the exercises. And even if you go for surgery, even that has some limitations too, right? So for example, stenosis, generally we go for decompression or laminectomy. That again, they will fuse the back. The fusing means you're losing the movement, and then losing the movements, you're making the back muscles tighter, and you will be having the problems like ongoing. So they can reduce the nerve pain, but again, you are at what cost? You're losing the movements and everything. That's the thing. Another thing, what benefits you are getting from the surgery versus what you're losing, you need to consider, balance that one too. Okay, so not all back needs surgeries, right? So next myth is, okay, so right, so I have done something like I have attended the physio, or I have used modalities that help my back. That means it's fixing the back, right? That's also not what happens here is we trying to do acupuncture, IMS, massage, spinal manipulations, everything to promote the mobility faster, to reduce the pain faster. But it is us where we have to keep ourselves active. We need to try to slowly. with our physiotherapy, though we use acupuncture, massage, and modalities, we always end up with giving exercises, right? So that is very important part. And the exercise becomes your part of your life, right? So we need to keep yourself active by doing that quite regularly. That way you are managing the flexibility of the muscles around the, as I discussed before, you need to, you are strengthening your core muscles, you're strengthening your hip muscles, you're keeping your muscles more flexible, you are avoiding the tightening. So that way you are reducing the stress on your body, and you are participating in the activities that you're keeping yourself more mobile, right? So these are the things where you need to consider to keep your back healthy as well. Next one is, okay, just a second, sorry. Yeah, so, oh, I have back injury, I should not be lifting weights. That's also a kind of a wrong perception. So we have seen many patients who had the back, really bad backs, and now they are going back to their work, and they are lifting weights, and they're going to the gym, they are lifting the weights. Again, as I said before, you need to know, you need to educate yourself. What's the back, how it functions, what are the mechanics, and what are the exercises do I need to do, and how I need to reach to the top level, right? So, oh, I feel, oh, I have attended for, Chandra has done acupuncture, is cleared my back. Right away, I'll go to the gym and lift all the weights. Then next day you will come back with the sore, even more bad sore, right? So gradual approach is very, very important. And we need to know the mechanics of those exercises. You need to know how you need to do rather than what you need to do. So these are the main considerations. By doing and following this one, definitely you can reach back to your what are the goal you want to reach, which you are doing before, right? So not all back injuries, we should avoid activities or lifting the weights or something like that. Okay. Now, so what can we do? So to reduce the backs, I'm going to talk about the simple exercise where we can demonstrate in the video. So kind of disc issue, the inflammatory back pain, generally we see in young patients in between 18 to 55 years. Generally what happens is I'm trying to bend and lift something. So I try to bend, that cause my pain. Even when I'm bending, it's giving me pain, right? So what we need to do, we need to go repeated extension, opposite side we are trying to do. That's helping us to improve the mobility and reducing the stress. So that is a repeated extensional lying exercise is very, very important. People who have that disc issue, right? So whereas stenosis is a little bit opposite. So when I try to stand up for a longer time, it's causing me pain. When I'm walking for a longer time, it's giving me pain. And when I'm leaning forward, I'm feeling good, right? So that's the stenosis arthritic changes, where we encourage to bring our knees to chest to start with slowly within the within your a comfortable zone to start with. And once you start improving slowly, we encourage go further and then start lifting your knees to chest, both knees to chest, like those exercises. We're going to present the video now. That helps to reduce the stress and stress on the nerves. And next one is sacroiliac joint. Again, this we need to use the muscle energy techniques, where the ilium is rotated wrongly and it is fixed that way, and we need to correct that one by doing that muscle energy technique, which we can show if we have that problem, right? So right, here's the video. So what I'm going to do, yeah, I think it will run now, is okay. It's Blade is demonstrating this exercise what I'm talking. So Sai, are you able to hear the Blair voice? Sai, can you hear the
video?
Video, yeah. Can you hear?
No.
No.
No, okay. Okay, just a second, please.
And feeling better.
Yeah.
So today's video blog is on two things that you can do.
I'm starting from the
depending
beginning,
on what time of day it is in your world. Blair Shackerby from Nose Creek Sport Physiotherapy, where we get you moving faster and feeling better. So today's video blog is on two things that you can do at home. There's a whole bunch of different types of back pain, but there's two main back pains that we see in our practice on a daily basis. The first one is inflammatory back pain. And typically that happens to us in our 20s, 30s, and 40s where we get a disc protrusion. So the bad ones are called herniations where they go out and don't go back in. The protrusions after time will shrink back down and come off the nerve, so the sciatic pain usually goes away, or the back pain. And usually for that we're doing what we call a backwards arch. So I'm just going to demonstrate that right away. So we're going to lay down on your stomach. We're going to put kind of an ice pack right on your lower back. We're going to stretch out, okay? And then we're just going to relax like Superman. Then slowly bring our elbows up into 90 degrees elevation, okay? Let our back sag there. Now if that's really painful, that's as far as you go, okay? If that's comfortable, then what you can do as you're getting better is you can squeeze your cheeks and try to arch up even further, okay? And then down slow, and then stretch back out again, like you're Superman, okay? And you're gonna repeat that 3 times in a row, and rest for 5 minutes. 3 times in a row, rest for 5 minutes. 3 times in a row, and then rest for 5 minutes. So you end up doing 3 sets of 3 reps, about 9 in total, over about a 15-minute period. And that can be done anywhere from 3 to 6 times a day, depending on how it feels. So if it gives you relief, you can do it twice in the morning, twice in the afternoon, twice in the evening. So for my younger clients, basically I say if it's a weekend and you can't see me right away, this is something you can do at home to start to basically reduce your back pain. And that's the inflammatory back pain. Okay? The second type of back pain that we see in our practice quite commonly is more of what we call a stenosis. Well, that's where we get arthritis, where the bone actually starts to grow, and we get what we call osteophytes growing down into the nerve canal, giving us sciatic pain and sort of a pinched nerve in our back as well. And that typically happens in our 50s, 60s, 70s, 80s, and up. And essentially the best exercise for that is what we call flexion exercises. And how you would try those at home is basically laying on a heating pad for about 20 minutes to half an hour, and just kind of laying right down, getting really comfortable. Basically just relaxing, grabbing the back of your knee and pulling your knee right up towards your chest till you feel a gentle stretch in your back. Hold there for about 5 seconds, and then back down slow. And then rest for 5, and then grab the other leg, and then pull that one up as far as you can till you feel a gentle stretch in your chest. I always jokingly say, don't try to get your knees to your ears on the first day. So just be really careful of how far you pull up. You want to be nice and gentle and just create a little light stretch in your back. You don't want to increase your back pain. If you're getting increased back pain, you're pulling too hard. So just really gentle there. So you do each leg individually, and then you rest. And you do 5 repetitions. If that felt good for your back, the next level of that exercise is basically reaching and grabbing both, and then pulling both up so you get a nice stretch in your back, and then down slow, okay? And again, hold for 5, rest for 5 if you can, and 5 repetitions is a good rule of thumb. And then patients will always ask me, like, how many times a day should I do this? Well, with that exercise, it's the same thing. If it feels good, you can do it kind of once in the morning, once in the afternoon, once in the evening, and you're getting relief with it, then by all means, the next day, I would do it twice in the morning, twice in the afternoon, kind of twice in the evening. And then definitely seek help if you can, because the sooner you get in for therapy, generally the better. But I hope that helps you guys, because that gives you 2 things you can try at home that basically should start to modulate or help your back pain. All right, so there you go, my friends. Blair Schachterly from Nose Creek Sport Physiotherapy, where we get you moving faster and feeling better. Take care, and we'll see you in the clinic soon. Bye-bye.
That's a nice presentation, Blair. Thank you. Let's move
Get
on.
you moving faster and feeling.
Sorry. Okay, so next, go for the next slide.
Good morning, folks. Good afternoon.
Yeah, so what are the frequently asked questions we generally exposed to? So it seems my back gets sore when my hips and hamstrings are tight. So what are the best solutions to stretch, right? So hamstrings are the muscles which are connecting from your ischium, we call part of the pelvic girdle, and it connects all the way to the knee. So if they are tight, it's not letting you bend your hips freely. So as I just demonstrated before, if your hips are not bending further, you're putting lots of movement in the back, lots of stress to your back. So very simple exercises where you lie down and just to stretch your leg. That helps to very simple way to stretch the hamstring. There are different ways too. Again, when you're doing this exercise, you need to maintain the mechanics really good. Okay, so hamstring stretches. Yeah, so those are the best to lengthen this tissue. Okay. And next one, is the ball chair good to use, and how long can I use it in a day? Right, so ball chair is a good one. So that is keeping ourselves upright, and you attempt to use the core muscles actively. But again, we encourage to change the positions from one chair to other chair, or sitting to standing. That way you are not aggravating, you are not doing everything in one go in one day. You're not aggravating those, you're not aggravating any back issues, right? So that's why we don't generally encourage to use it for kind of a longer and longer periods, or keep moving, keep changing the positions, okay? And next one is there any benefit by using the TENS machine for my low back? Okay. And then when you are, sorry, we're going back to the ball chair. So, we always encourage to use the active board. So where Blair is demonstrating, can you demonstrate again, Blair? Can you show once? Yeah, that's the desk, right? Where you keep, yeah. That's the desk that helps us to, that keep changing the positions, and static to static, sitting to standing, and keep moving. That's the main thing. Okay. So is there any benefits in using the TENS machine for low back symptoms? Yes, definitely. It will help to manipulate the pain information going all the way back to the spine cord and to the brain. So it is useful to minimize the pain, feel of the pain. And we can use it for 6 times per day, up to 30 minutes while you're lying down. And you can use the heat packs as well, and just try to do your activities as soon as the pain is easing, right? So what about a bed, and what do you recommend? My back is sore, especially in the morning time. So anybody who's generally, we see this one, I feel lots of stiffness happening in the morning time. So then general common questions we ask is, okay, how old is your bed? Right. So if general recommendation is up to 7 years, we can use a bed. And if you start noticing if it is becoming too soft, it's like when you lie down, it's becoming like a hammock bed. That's the time I think you need to consider to change the mattress. And there's a shop called I think Sleep Boutique in Calgary. I think it's there, and there's the guys. They can help us to guide which mattress. Generally, we encourage to go for the firm mattress with the soft top on it. That's really a good one for backs. Okay, but the guys who at the Sleep Boutique, they can guide you even better which one to get based on they sometimes nowadays we are seeing the custom made beds as well. So it's good to get the information about the beds where if your bed is too old and it's not helping with your back. Okay. Next one is what is sciatica, right? So sciatica, okay. So there's a nerve called sciatic nerve where it starts. Okay, so as I showed in the pictures, nerve roots are coming from your low back pain. And all these nerve roots come and join, especially it starts at L4, 5, S1, S2, S3 sacral zone. It will form a big bundle of nerve. It passes around the hip area and it goes all the way down and splits into further nerves. Any pressure on these nerve roots, what I'm talking, especially the lower back, and any pressure on the nerve roots that can give that radiating symptoms going back of the thigh all the way to my toes and back of the foot, on the top of the foot, that is sciatica. Another reason what happens is, as I said before, the nerve passes around the hip where, okay, so there's one muscle called piriformis. If this is a piriformis, the nerve passes behind that. Any alignment issues, as we are discussing, hip flexibility changes or changes in the pelvis, that can either put the pressure, or if you're sitting for longer time in like kind of low settee or low chairs, you are putting lots of pressure on the hip, and that is irritating the nerve, and you will feel that symptoms right away. Okay, and yeah, so these are the common signs and symptoms of sciatica, and we see that if a low disc, like any disc protrusions at the inflammatory, disc issues at the lower L4, L5 area, or any stenotic degenerative changes around that area can bring this sciatic pain. Okay. Now, I would like to show some information about our testimonials. Old patient who got benefit from our physiotherapy. Her name is Gabrielle, is one of our old Blaze patient. I'm not going to read everything, but I'm going to explain you briefly. She's a patient with lots of back issues. She had a fractured bone. She had couple of days, and she was not able to move. She was struggling to do her simple activities, and activities like gardening, yoga, and she was active, very, very active before. And after this injury, she was not able to do anything, and she got a belief that, oh, my activities which I love is ended for my life, so I cannot do further, right? So then she had attended Nose Creek, and she has been through this low back education, and she followed the exercises really thoroughly, and she started improving now, and she slowly got back to her yoga. She's able to do her yoga and activities like jogging and gardening. She's back to her routine, and just she's very, very happy patient, right? So that's one. And next one is Mark, had been through the similar injury. He has given as a nice video testimonials we would like to present. So I'm going to play this one.
All right, good morning, I'm Mark Wensrich, and I originally came here in about 2008 for a back injury that I had where I was increasingly locked up, and I tried everything from yoga and acupuncture and just wasn't getting any results. Went to my family doctor, and he recommended Blair to me because he had the exact same back problem. And Blair was his physiotherapist, and right away we got into why I was having the problem, which was a mechanical issue where I had weak stomach and supporting muscles. So no matter how much I had done in other ways with painkillers and whatnot, it would never fix the underlying issues. Within about 6 or so sessions, sounded like I had a 2x4 snap in my back as everything started moving again, which was good. And I appreciated the good customer service I had because unlike previous physiotherapy appointments I'd had with other organizations, Blair actually gets down there, does the exercise with you, shows you how to do it properly and makes sure that everything's going right. And the whole front office staff has been very kind to me and very friendly. And then, of course, I wound up back here after an injury where I messed up my shoulder, and I wound up in shoulder surgery recently, so I couldn't lift much more than about 5 pounds. Came back to see Blair right away again to deal with the shoulder because pre-surgery, we wanted to build up the muscles so that post-surgery I would have a faster and better recovery, which is what has happened. I can now lift up to 25, 30 pounds with my arm that I could have previously only lift 5. And I would absolutely recommend these guys because they are a wonderful staff all the way around. And like I say, they actually take the time to make sure you're doing your exercises properly. And that's the thing. They're going to show me how to do the exercise, and it's my job to actually get there, do the work, and that leads myself to a healthier life.
Okay, so that's a nice testimonial, Blair. Okay, next. Okay, so right. So what are the treatment options here? So you tried everything. It's not helping. So you need to make the decision now, right? So and this back pain is disturbing. So now you may be unable to walk normally, even at rest, and comfortably at night. So just follow the instructions. I mean, the instructions which we have shown, and follow that one. So if it is not helping, that is the time you need to seek help. So what happens next is you need to make the decision, and just give us a call, and we can make a discovery visit, which is a 15 minutes. We can discuss. We can get an idea how extent is the problem and what we need to do. That's the best. And to get that one, just I would like to pass the information to Sai. Give us a call, or either you can email us. You can leave a chart here. You can leave a comment on the chart, so we can arrange a free discovery visit that helps us to just guide us which route we need to go. Okay. Right. So why Nose Creeks, right? So we have wonderful staff here, as you're seeing here. We are happy faces, and Sai is also there in the picture, right? So yeah. Right. So we, as a physiotherapist, as I said before, we will do a comprehensive assessment to find out where the root problem is, and then based on that we will design the treatment plan, and we will discuss with you, and we are trained with the mobilizations, and most of our therapists are trained with the needles and acupuncture as I do, and Blair can do manipulation. So there are lots of options are there, and main thing is we are patient specific treatment plan. We will make it, not like, okay, oh, you got back pain, oh, take this home, and not like same for everyone. So we are individualized care plan. We'll make it on the day of assessment. So definitely we will we have been seeing a positive results with our treatment plans. Okay, so that's I'm proud of. Okay, so next. Okay, so hope you enjoyed this video, my presentation. Thanks for coming. And there are 2 ways to contact us. One, you can make a phone call, or you can leave a chat here, or you can email us. And if you want the information about the back, please feel free to download from our website. If you don't find it, you're finding hard, either you can email us, you can call us. We are happy to send it to your email. And if you want to have a further discussion, just feel free to make a discovery visit. So either we can do over the phone, or you can come in person into the clinic. So we can do 15 minutes chat to find out what's been happening and which directions we need to go through. So that's another way. And if during the discovery visit, if you have any specific questions, feel free to ask, and then we are happy to answer those questions. Okay. Right, Blair, do you want to add anything, Blair?
Awesome. That was great. Good job, Chandra. So yeah, I'll step off my active office board now. I've been enjoying that. It feels good, actually. That's a tool that we can order through Fitter First. It's like $100. Louis Stack invented it in consultation with basically NASA researcher, but anyway, it's a long story, but it's a great tool. Like, I just did that for the last 10 minutes. My back feels wonderful because we're working muscles, like Chandra was saying earlier, and we're firing nerves. So you're keeping your back active. I just did a study recently. They showed that you burn 300 calories standing at your desk per hour. And that's, again, because you're not static, you're actually moving a little bit, and you're typing and you're moving. So we know that standing is a lot more healthy than sitting, for sure. All right, so I don't know if we have another. Can you advance the slide there? And I have to apologize for this slide. Looks like you got overlapped. Yeah. So we are going to do 5 massage gift certificate draws. Tonight we won't be able to do the wheel because Belle's not here. But what we're going to do is Sai's going to put everybody that attended their name into a hat tomorrow. And tomorrow morning we're going to draw it out of the hat. And then Sai will call the lucky winners. So there'll be 5 people that will get a 1-hour free massage with our new massage therapist, Linda, who works every day except Tuesday during the week and Saturday mornings. So it'll be the best hour of your month, I tell you. She's amazing. So we'll just kind of follow up with you guys tomorrow. And again, there's 2 ways you can follow up with this. If you're just beginning your journey with lower back pain, you can go to our website, download the free report. When Amanda or Sai or Sandra follows up with you in the next couple of days as well, they can send you an email of that free report if you're not quite sure, you had trouble downloading it. But if you go to our website, www.noseCreekSportPhysiotherapy.com, usually you just go under the there's a, I think it's a body parts in the top taskbar, and it'll go through. There's 5 or 6 different reports we have. So if you click on that, when the first landing page shows up usually on the right side, it says, though, you'll see a picture of a book, and you just click on that, give us your email, and then we send you the report. So it'll be similar stuff and content, just like Shandu talked about tonight. And then, do you have another slide there, Shandu?
Yeah.
Just to make sure we're at the end of our, yeah.
So now the question and answer session. So feel free to type your questions if you have any, and just feel free, any question, that's fine. Okay, we'll aim to answer. Yes, Sai, please go ahead.
Yeah, I actually have 2 questions from our audience that they typed in our chat message.
Okay.
Messenger here. So one is from Cindy, and her question is, could low back dysfunction cause hip and knee pain before low back pain starts?
Sorry, can you repeat that? Sorry.
Could low back dysfunction cause hip and knee pain before low back pain starts?
Yeah, so so I would like to talk about the nerves, how they are passing, right? So I talked about the sciatic nerve, right? So all these nerves, every muscle is supplied by a nerve, right? So any pressure on the nerve that is not so nerves are the something which doesn't like to be touched, right? So if you have any pressure, wrong pressure on the nerve, specific nerve, for example, if I have to lift the leg up, right? So that's L3 L4 we call. And if you have any pressure on the nerve, it doesn't need to be too much damaged or too much of pressure on it. Even very light feather touch, you're not sending the enough impulse to the muscle, and the muscle tends to become weaker, and if muscle is not working properly, alignment of the bone, you might be using the other muscles to compensate this one. That can changes the mechanics of the joint. That can bring the pain as well. So yeah, so recently we are doing a course called IMS where they are working on the nerves more, and so it's very interesting. So if you have any knee pain or sometimes Achilles pain, I've seen a recent demonstration. They're working on the back that helps to ease the pain. So again, as I said before, we need to do a comprehensive assessment where the root cause. So we need to find out, is it a pain problem is a localized to knee, or we can check all the tightness, weakness of the muscles, or we have to check the back as well. So assessment is a key part here to find where the root cause is. Yes, that can bring, yeah.
Chandra, I have a question.
Okay, yeah.
Can you kindly tell me, from your expertise, how do you determine whether it's a protrusion, a stenosis, or piriformis syndrome that might be causing a patient's pain?
Okay, so we will consider the history of the what happened, right? So for example, take the disc problem. So commonest thing what we say is bending forward and doing a wrong twisting and turning. Whereas stenosis, you will get more pain when you stand for a longer time or lean back, or when you walk for the longer time. That's where you get the stenosis. Is a flexion problem or extension problem. So flexion problem could be a disc issue, problem with the disc. Leaning back in extension problem could be a facet joint issue, or stenosis, or sometimes listhesis. That's how we differentiate. And piriformis, again, as I said before, right, it will start at a lower back. So L4, L5, S1, S2, those are nerve roots formed together, forms a big nerve. And how it is directing. So when we are checking the back, any problem we identify that, and again, symptoms, what you are saying, oh, I'm having the back problem, back of my thigh, back of my leg. And when we check the segments levels, if any stiffness, any tenderness, any tightness around the muscles, and hip joint flexibility, all we consider, and we look for the tightness with the piriformis muscle. When you cross your leg, if you are not able to keep it more flexible, and that's another thing we need to check. And if you palpate the muscle, right, so that can again irritate the piriformis. That's how we differentiate from disc versus stenosis versus again problem with the piriformis. What do you say, Blair?
Yeah, that was great. Can you put us in the gallery format now? So we can see the people asking questions as well.
You mean this one?
So maybe just close the PowerPoint.
Oh, okay.
And then just go into the gallery. Usually if you stop share,
Okay.
yeah, then it'll go in. There it is. It goes into the gallery.
Okay.
Yeah, there it is. Perfect. Yeah. Good job. He answered that perfectly. So if you got an arthritic back, when you lean back, it gets worse. If you got a disc, it gets worse when you bend forwards, because the protrusion pushes into the nerve when you bend forwards. And SI joints, they usually come in and they'll have their thumb right there and they'll say, Blair, it hurts right there. So they can usually localize it really well. And it's just on the inside upper part of the cheek, and they'll go right there. That's a spot, and then we'll test their hip. We'll check their piriformis, and that produces more pain. So you can almost get what they call a pseudo sciatica, where you're not actually pinching the nerve where it's coming out of the foramen or where the disc might hit it. You're actually pinching it and compressing it because the piriformis is in spasm. And like he was saying, the sciatic nerve is here and then your piriformis is on top of it. And if your pelvis twists, the piriformis tightens up to stop the pelvis from twisting any further and then compresses the sciatic nerve. So with those pseudosciaticas, we know they're usually SI joint generated. And so as a physiotherapist, we're passionate about getting to the root of the problem. And that's what he made a great point tonight about medication. I'm sure all of you, because you've been around for a while, know that medication will kind of reduce the symptoms, but it never fixes you, right? And that's really what medicine does. You know, the doctors are saying, oh, you have swelling. Well, let's take some anti-inflammatories. It'll help the swelling. But for pain, like when it comes to nerve pain, most of you know there's nothing that really gets rid of nerve pain. Like, you know, I had a headache today, so I took a couple of Tylenol. And so Tylenol will give you sometimes like headache relief. But when you have nerve pain, it doesn't even touch it. And the only medicine that basically will eliminate nerve pain, you know, you can't function because, you know, it's a really heavy medication. So our goal is to get down to where the nerve is being pinched, to get the pressure off the nerve as soon as possible, to give you that relief and allow that nerve to calm down. And you can have a hair sitting on a nerve and it'll elicit a pressure response. So that's how sensitive the nervous tissue is. And that's what Chandu said earlier, is that it doesn't like to have pressure or anything touching it. So that's why we want to get that mobility and the pressure off the nerve as quickly as possible. Yeah, are there any other questions from the gallery?
Okay, I'll ask one.
Sure.
I think I have the SI joint issue.
Okay.
And so do I understand it right? It's because maybe my pelvis is just sort of out of alignment. And so can you fix that alignment, and does it stay fixed, or do I have to keep fixing it every day?
Go ahead, Chandu.
Yes, we can check the alignment issues and we can correct the alignment issues as I presented in the slide, right? So we can use a technique called muscle energy techniques where we move the joints in their specific position, and we will ask you to resist the movement, and that way you are trying to correct the positions. And another thing is, pelvis is surrounded by big muscles like hip muscles and abs, right? So having these muscles, strengthening them, that will keep them aligned properly. And another thing is a flexibility issue, right? So have any problem around the, as Blair saying, any tightness in the piriformis, and that can create the problem, right? So what is the flexibility? Is there any flexibility missing? Is there any weakness in your hips? And sometimes you're in the front of the thigh muscle, we call iliopsoas. That can bring the pain as well. So tilting the back in the wrong directions, and it will changing the mechanics, right? So by maintaining the mechanics and flexibility, strength, yes, you can maintain that alignment for a longer time. It's not like it's going a permanent damage or permanent change.
Yeah. So there's two things that keep your pelvis together. There's form closure and force closure. So form closure is what God gave you. I can't change that. Neither can Chandu. I wish we could. If we had a magic wand. But force closure is what we as physiotherapists are really passionate about. So we'll teach you how to upgrade muscles that will actually help give you that dynamic stability in your pelvis. But as we age, the number one thing that starts to aggravate older SI joint patients, like people in their 60s, 70s, and 80s, is a stiff hip. So the SI joint is probably the victim in your case right now, and it's the hip that's the culprit. So we're going to have to chase after your hip mobility, get you doing lots of stretches in the hip, and then offer you some strengthening around the hip area to help compress your pelvis. And then that would directly relate to SI, some core exercises as well for your abdominal muscles and your back muscles. So I jokingly say to all my SI joint patients, by the time, in about 4 months, you're going to have legendary abdominals and buns of steel. I always jokingly say, because you got to build up those muscles because the ligaments basically are worn out. And the same thing happens with their feet. I had no foot pain until I turned 40. Because about halfway through our life, our foot starts to just give way and it flattens and it gets wider and it gets longer. And that's when orthotics come in and can really be helpful for people over 40. So I wear them at work when I'm standing on concrete for my long clinical shifts, and I just love them. I can't work without them now. So yes, we can change the position of your pelvis, and yes, it will stay together. We can't guarantee that though, because you can slip and fall in the winter and then you can shift it. But if that happens, then you just give us a call. We always jokingly say, we got got your back, you just get back in, we can do a tune-up session and get you back on track. But yeah, getting the pressure off the nerve and getting the pelvis back to a symmetrical position is really important, Royaline, for sure.
Oh, okay, thanks so much. Yeah, I think I just might follow through. I'm doing a whole bunch of exercises. I'm working out 6 days a week.
Good job.
But yeah, but you know, that pain is still there. I can't sit there. Like, this is hard sitting here.
Yeah.
Right?
And so when you come in, bring in your gym program too, because we'll have a look at that. Typically, when people are doing fitness programs, there's 2 or 3 things in their program that it's actually aggravating their injury. So we try to educate people that let's just take those 2 things out of the program and let's substitute in what we call the indicated exercises and get rid of the contraindicated, the bad exercises that we know are going to make that pelvis joint worse. Yeah.
Okay, thanks.
Yeah, awesome. Great question. Hey, great presentation, Shandu. So last chance, does anybody have any more questions before we close the night? Okay. It sounds like I don't see anybody waving their hands or, so I think we're good.
I'd love to come and see you.
Oh, there you go. Florrie's going to come and see us. All right.
I've
Again,
been meaning to.
there you go. There you go. So
Thank you.
you're very welcome. So the next step is to book a free discovery visit with Shandu, and he'll sit down and chat with you in the clinic, or we can do it on telerehab in the comfort of your own home as well for 15 minutes. And basically what we do is you go take you through a history and sort of get to know you, and we get to know your specific history of how your back pain has kind of evolved. And the reason why we like to do that is we like to do a deep dive into your history, because there's always something I find when someone has a back pain that's actually, the back is the victim. There's another old injury, whether it's their hip, their knee, or they broke their ankle 10 years ago and they haven't walked the same since. And that's why we like to kind of get a real comprehensive history. And then from there, we can basically screen you to make sure you're appropriate for physio. And then we just walk you to the front and book you for the full assessment after that. Or we send you back to the doctor's office if there's some stuff we want to rule out before we start you down the physiotherapy and the rehabilitation road. But anyway, Shandu's really good at that. So that would be the next step for most of you. And
with COVID.
yes, that's right. Yeah, just make sure. And we're a very safe place. We're still continuing all our COVID health protocols. So we've got our questionnaires we do. We've got our temperature that Sai does on everybody as you walk in the front entry. And we're still masking up and doing our sanitizing so that we're still a safe place to attend for sure. All right. So
Blair, can we phone and make an appointment with Shandu?
You certainly can. Yeah. Okay. So you can call the office tomorrow morning at 403-295-8590.
I got it.
Yeah, and Sai or one of our team members will be reaching out probably tomorrow to everybody just to check in and make sure that if you have any other questions, they can book you a discovery session with Shandu, because our team is great. Like if you ask them a technical question, they'll say, "Well, I'm not a physiotherapist, but I can book you some time with one if you want to ask them, the specific pathology questions." So they're great that way. Yeah, we really believe in education, because half of the recovery is based on what you learn about your injury and how you manage it in the future. That's really where the success lies. Awesome. All right, so I'm going to sign off and I'll let Shandu have the final word. Thanks, guys.
Yeah, thank you for attending, and thanks everyone. It's a nice
night.
meeting you all over the video. Yeah. Thank you very much.
Great to see you guys. Have a good night. Good night.
Thank you. Yeah.
There we go. Hey, Linda's here. Hey, Linda. Can you unmute, Linda?
Yeah.
Hey.
Hey,
sorry.
Linda.
Hi, how are you?
Good. I saw you sneak in there. That's great. I'm glad you made it to the low back presentation.
Yeah, I'm so sorry that just now I pressed accidentally on that button and that waved at you. You were asking.
Oh, no, that's okay. No problem.
Sorry about it.
Oh, no. We should have actually got your picture on. Next time if you show up, make sure you get your camera working, so that way we can introduce you to the people that are in the presentation, because you'll be the one that sort of gets most of our new prospects coming through the presentations for the free massages. Yeah.
Yeah, thank you so much. Hey,
you're very welcome. Did you have a good day?
Oh, yeah, I did. Thank you
good.
so much. And you?
Super duper. Yeah, it's been busy. I got up early and And my wife, who's never played badminton her whole life, is now coaching badminton at her high school. So she had to leave at like 5:30 this morning because she had to go to the school and set up the gym for 7 o'clock badminton practice. And so she informed me for the next 5 Wednesdays I have to drive the kids to school because they don't start till like 8 and 8:30. So yeah, so I was up and drove the kids into school, and yeah, it's just been a great day. And I went around and looked at some more facilities today for my mom. So that was interesting to go see a couple more facilities, learn more about that whole industry.
All right, that's good. That's
Yeah.
good.
How about you? Did you have a busy day?
Not really. I had only 2 patients, but then it was okay. Yeah, just doing something else, do some reading, whatever. Yeah.
Okay.
No
Good. Well,
worries.
we'll get you some more.
Yeah.
Yeah,
sure.
for sure.
Thank
Some more will
you.
come out of this presentation for sure. Sai will fill you up, right, Sai?
Yeah.
Awesome. Okay. Well, on that note, I'm gonna say goodnight. And I'll see you guys tomorrow. Good job, Shandu. Awesome.
Thanks, Blair. Thank you very much.
Yeah, you
Thank
did a great
Thanks very much,
presentation.
Sai.
Thank you,
That was
Bye,
great,
Linda.
Channel.
Great.
Bye-bye.
Bye.
Thank you. Thank you.
Thank you.
Yeah. Bye.
Good
Bye.
night to you all.
Bye.
Bye.
See you.